Hi, I'm Stephanie.
And I'm Yvette.
Welcome back to Medicare at 65 Kitchen Table Talk conversation with Simplicity Advisory Group. We are a Medicare plan center and we work for you, not for the insurance company. Today, we are going to talk about a very important topic, retirement after age 65. Grab a cup of coffee, like and subscribe, and please share with a friend.
We at Simplicity Advisory Group help seniors, veterans, and those with disabilities or may have Medicaid, and families with aging loved ones navigate Medicare and their health care options or their health insurance options. Today, we're talking about an important topic for many adults who continue working after age 65. And there are probably more people than you think that are continuing to work after 65s. And what changes when you finally retire?
You got to be careful when you're turning 65 because there are some costly mistakes that some people make. A lot of people delay their retirement and they keep their employer-based coverage after turning 65. But once you retire, things happen.
Absolutely.
Right? So there are some important decisions and deadlines that you must know about.
Yeah, absolutely.
And understand, you must understand that, right?
Yeah, and actually understanding what is expected of you when you retire, and that includes your employer.
Right.
Understanding those changes can help you avoid penalties and coverage gaps and unnecessary stress.
Many people today are working longer.
Absolutely.
Right?
Absolutely.
Whether it's because they enjoy working, right? Picture that. Or they just want additional income or need additional income.
Understanding those changes can help you avoid penalties, coverage gaps, and unnecessary stress when you're retiring or moving from an employer plan.
Yeah. Many people, as you know, we see it all the time. Many people are working longer today.
Absolutely.
And maybe it's because they enjoy their careers or they just want additional income or they need employer-based health coverage.
Absolutely, yeah. And while you may be already enrolled in some form of Medicare, and even not necessarily enrolled, but if you've worked 10 years or 40 quarters, you're entitled to that Medicare Part A when you turn 65. Yeah. But you still have to enroll in it. So your health care situation can change quickly once you retire.
Yeah. Yeah. And one of the biggest changes is losing your employer health insurance. And I think that's where it becomes a little confusing to people.
That's right. Yeah.
They kind of think everything is the same and it's not.
Yeah.
It definitely changes.
Yeah. And I think sometimes people think about the penalties and am I going to get a penalty or not? Yeah. But if you have employer coverage, you just want to make sure that it is credible coverage before your 65th deadline. And if you're still working, when the coverage ends, Medicare usually becomes your primary coverage or your primary health insurance, which is 80%. Original Medicare is that A and B.
And timing is everything. Right?
Absolutely.
It's all about the timing. That's so important.
Yeah. And when you retire, you're actually triggering what we call a special enrollment period. And that special enrollment is SEP, a special enrollment period, which allows you to enroll in Medicare coverage without obtaining a penalty. However, you will need a documentation from your human resource department or HR department that indicates that you had credible coverage when you started working with the employer, when your insurance ended. If it hasn't ended, that's fine too, but it needs to be indicated on the form, and it also needs to be signed by your human resource representative.
So understanding like those special enrollment periods, you typically have a limited amount of time, right, after your employer coverage ends to enroll into Medicare Part B.
Absolutely.
And your prescription drug coverage. So you cannot delay that. I mean, we talked about it before, and in previous videos, those penalties that you can incur when you delay those enrollments.
Absolutely.
Yeah.
And the thing that you want to think about is that you don't want to wait until your retirement. We want to make sure that you are scheduling and planning prior to. So missing that window of enrollment could result in penalties.
Absolutely.
Or, like we said, delays in your coverage. So missing your enrollment window could lead to penalties that will be applied to your Part B premium. And if you don't enroll during your time of eligibility, prior to enrolling and losing your employer coverage, you can incur a 10% penalty for every 12 months that you are without Part B premium. I mean, Part B. And then you also can incur a 1% penalty for every 30 days that you are not in a prescription drug plan. And those penalties will be added to your Part B premium, and those penalties can, in most cases, be a lifetime.
Yeah.
So it's just really important that you don't miss that window.
Yeah, and that's why we always encourage people to start planning ahead.
Absolutely.
So don't wait the day before you retire or the month before you retire. It's a process.
That's right. Yeah.
So, I mean, if you know you're going to retire 6 months or even a year before, it's important to start getting that ball rolling or just starting to sit down and talk to people or talk to an advisor, I should say, about it.
Because we want to make sure you have your documentation, your HR representative, things like that. So, so another major change that you have to consider when you're retiring is your Medicare coverage. What fits your needs after retirement? And we do a pretty thorough job of doing a comparison of maybe what you have now with your current employer and what needs and costs you may incur with changing into a Medicare options.
So you may want to consider, like, there's 4 things that you can do. You can enroll into Original Medicare and let that be your insurance. And Original Medicare, as we said, it has 2 parts to it, Part A and Part B. That's going to be primary for you. There's also there's supplemental plans, which are going to be secondary to Medicare. Then there's the Medicare Advantage plans. Once you enroll into a Medicare Advantage plan, that becomes primary for you. And then you also have prescription drug plans. So take, for instance, you enroll into just Original Medicare. You just can't have Original Medicare because it does not have prescription drug coverage. So you have to get that alphabet.
Absolutely.
That D.
That's right. That's right.
Which is your prescription drug plan.
And one other area that's really important too is you have to look at your healthcare needs, your travel habits, your prescriptions, and budget. All that will play a role in choosing the right plan and choosing what healthcare choices or what direction you would go when you're making your decisions after retirement.
Yeah, because I think some people are a little confused by that, to learn that their current doctors or even that their current prescriptions may not be covered, right? Because people don't realize that the insurance that you have through your employer may be vastly different in your Medicare Advantage plan. So
Absolutely. Yeah.
a lot different.
And even just like a standalone prescription drug plan. So that's why reviewing provider networks and drug formulary is so important before enrolling into your Medicare option.
All right. The last thing anyone wants is any unexpected costs. And like we said before, and we say it all the time, you already have that premium of $202.90. You don't want any unexpected costs, right?
Absolutely.
So that's why it's so important to sit down with a trusted advisor like ourselves.
Absolutely. And you don't want to have to change providers and don't feel like you have to either. So healthcare becomes a bigger part of retirement planning after 65. I think we do see a lot of our beneficiaries who just kind of look at their 401ks or their annuities and pensions. But I think we really have to consider and factor in what our health care costs will be as well.
That's right. Even with Medicare, you still want to be mindful of the deductibles and the co-insurances and co-payments that you have. Even your dental, you have dental costs, vision costs, and things like that. So it could be a little overwhelming. So be mindful of all those out-of-pocket, expenses.
Absolutely. So having a plan in place can help and make retirement feel much more secure
right.
and less overwhelming. We often say plan with perfect purpose and live with confidence.
Yeah, and retiring at 65 is supposed to be exciting, not overwhelming.
That's right.
Right? You don't want it to be overwhelming. So, again, sitting with a trusted advisor, you know,
And the earlier you prepare, the
better.
smoother the transition can
Exactly.
be. And these are conversations you can have, so you know what options you need to take.
Yeah, and you say education is key, right? So
right.
sitting down with an advisor and learning all these things, you know, is education. So, you know, you can help your neighbor or friend or a family member.
That's right. If you found this video helpful, please don't forget to like, subscribe, share it with a friend. And we also appreciate your comments and any topics that you would like to see us cover.
And if you have any questions about Medicare enrollment and retirement, please reach out to someone from our team. Thanks for watching.
Thanks for watching.